All right, got a little quick snippet here for you, a caution, if you will, about giving pediatrics steroids and needing to watch their glucose with that. I found a couple little slides here. They kind of sort of correlate. This came out of the respiratory chapter. But kids with asthma, they're often prescribed inhalers, and along with that, a lot of times they're prescribed a corticosteroid. Corticosteroids are glucose derived or have an effect on glucose, and they can cause some really rapid changes in a patient's blood glucose levels. And as we all know, kids don't have those reserves and the kind of advanced way of, well, how should I put that? They're not able to accommodate those rapid changes quite as easily as some adults might. And so whenever a kid is on corticosteroids, it's something to watch, is just watching their blood sugar. They could be really low. Typically it's really high, especially if they're on a lot of steroids for a long period of time. So if we find a kid that is on steroids for asthma or whatever reason it might be, it is very important to keep in mind that we might not just want to give them a bunch more steroids like Solumedrol that we carry on the truck. We want to use caution with giving them even more steroids until we check the blood sugar, assess the patient really well, and make sure it's not going to have other effects on that. On the other side of things, if we're running an asthmatic patient, if we're running a hyperglycemic pediatric patient, be sure that we do check their medication list if they have one, and see if they're already on steroids that could be causing this hyperglycemia. Maybe it's not technically diabetes causing the hyperglycemic event. It can be something like corticosteroids that they've been receiving that can cause that elevation in blood sugar. It's just something to watch for there. Assess your patients really well. Use good sense, follow your protocols whenever you're given that steroids, and just know that corticosteroids can mess with blood sugars, especially with the kids.